Okay, so now we're going to do two more muscles in the lower extremity and a few more in the upper extremity. So the first one we're going to do is going to be the iliacus. So again, this is not a muscle that's routinely done, but again, for L5 muscles, for for L4 or L2 radiculopathies, this is another alternative muscle that you can check. The iliacus is a little bit more proximal than rectus femoris. So the iliacus is right up. There's the ischial bone coming around here. We're going to come right into the anterior part of the thigh bone, right into the anterior thigh towards the medial side. As soon as the person flexes their knee, brings their leg and flex their hip, so bring your leg up off the table, I can feel the muscle popping up underneath my finger. So I know that's where it is, and relax. Good. So that's the iliacus muscle. So I'm going to take my alcohol wipe. Place it right there. Again, this one for larger people, you may need a longer needle. So we're going to put it right there, but 2 inches should be fine for here. Okay, let it dry for a second. My sound is on. Good. Okay, so here I am. I'm not going to venture too far laterally, even though even though the femoral pulse is quite far away. I'm just going to push it straight into the muscle, straight down, and I'll get to the muscle. Okay, nice and relaxed. Here we go. Feel okay? All right, I'm going to push a little deeper. Okay, I'm in muscle. Bring your whole leg up off the table, and there we go. Now we're in the muscle. So and relax. So I'm in that muscle. I'm in the iliacus muscle. So there's my first depth, second depth, third depth. Good. I can extract it out and slightly change my angle to redirect. And I lost the muscle, so I'm going to move it a little bit. There we go. Now I'm back in. Second depth, third depth. Good. Extract out, redirect, back in the muscle. Second depth, third depth, waiting a second or two in between. I can move these a little bit closer if I'm getting too much noise. There we go, that's a little better. Extract out, let's find the last quadrant. 1, 2, 3. So those are 3 depths, 4 quadrants. I can now stop the buffer and store it under iliacus. Good. Go back to live again. Go to 200 on the gain. So very gently, try to bring your leg up off the table. Push up straight. Good. A little bit too hard, just a little less. Good. So there's some nice motor units there. Good. Normal amplitude, normal shape, normal duration. Doing okay? I'll redirect it, try to find some more. There's a nice motor unit, keep going. Keep pushing up, good. Good, there's some nice motor units there. Good, keep pushing. Good. So let's pretend that was 12, very good, and relax it there. Stop it, store the buffer, there we go. Go back to live again, go to 500, and this one's probably not going to get that great activation. Okay, very gently bring your leg up, push up in the air, good. Okay, now go a little bit stronger. Looking to see how those motor units are recruited, see if they're getting bigger and more frequent. Go a little stronger. And go a little more, and go a little more, and a little more, and a little more, and relax. Good. And we got nice, decent recruitment there. Stop it. Stop the buffer. Store live buffer. So now we have our 3 buffers. So that is the iliacus. So again, just make sure no bleeding area. Even if there is, just a little dab. Okay, put a little pressure there, and then now we'll go to the soleus. So we'll go to the other opposite end of the leg. So the soleus is very similar to the gastroc. The soleus has has a little bit of L5, but mostly S1, S2. Again, it's not one that's commonly done because there's a lot of other nice ones to check, but this can be done if needed. Maybe if you have a person with a calf injury or other types of injury, you can do the soleus muscle there. So let's go to soleus, select it on the screen. Now we're on soleus. Okay, so the soleus is going to be, there's the gastroc, so the soleus is just underneath it. So the soleus is just distal, caudal to the gastroc, or distal to the gastroc, right over there. And the action is going to be the same. It's going to be plantar flexion. So very similar to the soleus, to the gastroc muscle, just a little bit more distal. So we place our electrodes here in the area. Again, the motion is going to be plantar flexion, so the patient's going to step on the gas, push down. There's the muscle right there. Okay, let the alcohol dry. Good, okay. Okay, nice and relaxed. Here we go. 1, 2, 3. Feel okay? Okay, needle is in. 1 depth, 2 depths, 3 depths. Extract out, redirect. 1 depth, 2 depths, 3 depths. Extract out, redirect. 1 depth, 2 depths, 3 depths. That's our third location. Redirect. 1 depth. He's contracting a little bit, relax. Heard some little background noise, so that's good, good. 2 depths, 3 depths. So there's our resting assessment of the soleus. Nice and normal. Stop. Store live buffer. Go back to live again. Go up to 200. So this one is going to be plantar flexion. So gently push your foot down on the gas. Good. Get some nice good motor units there. Nice normal size motor units. Not normal amplitude, normal shape, normal duration. I can go a little deeper. There's a couple different, there's another nice one motor unit there. I went a little deeper, got another one. There's another motor unit, went a little deeper, good. Okay, relax it. I'm going to redirect it to try to find some more. Okay, missing the muscle. I'm going to redirect it. There we go. Okay, there's some nice motor units there. Good. There's another one. There's 2 more motor units. Normal amplitude. That one of them looks polyphasic. So that one could be an abnormal motor unit. No, it's normaling out. That's good. Go a little deeper. There's another one that had that large one on the bottom that has multiple turns, but not polyphasic. Multiple turns, but not polyphasic. That one motor unit that's on the bottom of the screen there. So let's pretend that was 12. So I'll store that. I'll stop that, store the live buffer. Now I'll go back to live again. Go to, whoops. All right, go to 500 on my gain. And very gently push down, step on the gas. Good. And go a little stronger. Looking for more motor units to be activated, or to be recruited. Activating more and more motor units. Go a little bit stronger. Good, a little more. A little more. A little more. And relax, relax, good. Activated all those motor units. So I stop that there. Take the needle out, stop the screen, and store the buffer. So that is the iliacus and the soleus. No blood there, which is good. Now we're going to just switch for a second. We'll do 1 muscle on the arm and then 2 muscles of the shoulder. Okay, so now we're going to do the flexor carpi ulnaris. And again, this one is not commonly done also because it is often one of the things that causes or impinges on the ulnar nerve, but you can check it if you suspect C8. So it's right distal to the epicondyle on the medial side. So I'm going to come in here, and this one, the motion of this muscle is going to be flexion with ulnar deviation. So you really need to get that ulnar deviation in order to get that activation of that muscle, because flexion will get both of them as well, but it doesn't really get the good power unless you add in the ulnar deviation. So we're going to add the ulnar deviation with the flexion. So the insertion of the needle, we're going to come in and we're going to insert it and go in down that way. So we're going to be as far medial as we can and inserting the needle down distally towards the hand that way. Okay. So we have our gain set at 100. I went to the shorter needle for the upper extremities. Okay, so nice and relaxed. Here we go. 1, 2, 3. Feel okay? Okay, and if you want to check it, bend your wrist up, and there we go. So we got some nice ulnar deviation with flexion, and we're inside that muscle. Good, and relax. So now we'll do the same thing, 3 quadrants, 4 depths. 1, 2, 3, extract out, redirect. 1, 2, 3, extract out, redirect. 1, 2, 3, extract out, redirect. 1, 2, wait a second, and 3. So no prolonged insertional activity, no spontaneous potentials. That's normal. I can stop that. Store the live buffer. Now go back to live again. Go up to 200. And now I'm going to resist ulnar deviation and flexion. There's a perfect motor unit there. Nice and isolated. Single motor unit, normal amplitude, normal shape, normal duration. I'll move the needle just a little bit down. There's another one. Keep going. Good. There's a second motor unit there. And there's some more motor units. A little on the bigger side, but still okay. Very good. Okay, I'm going to redirect it again. Okay, bend your wrist up, push up. Good, a little bit too strong. Good, perfect, just like that. So he was going too strong, so they looked like they were a little bit bigger, but he was going too much force. There was too many motor units on the screen. So I asked the patient to just lessen their contraction a little bit, and now we're getting some nice, smaller, normal size motor units. When he was going a little bit too hard, we were seeing two of them. They were too large, but they were not large for that level of contraction. He was going too hard on his level of force. Okay, go a little bit more time. There we go. There's 2 more normal motor units, normal shape, normal amplitude, normal duration. Good, and relax it. Good, relax. Good. Stop the buffer and store it. And then go back to live again. Now we'll go to 500. Okay, very gently, bring your wrist up, bend up and in. Good. And going a little stronger. And going a little more. A little more. A little more, a little more. Push, push, push. A little more, a little more. And relax. Good. Rest. Very good. So we got good recruitment there. Stop the buffer. And store live buffer, so we get good interference pattern on the flexor carpi ulnaris. Take the needle out, and good there, no blood there, very good. That buffer is stored. Okay, so the last 2 are going to be muscles of the shoulder girdle. So we're going to ask the patient to lay onto his side again, onto his left side, please. Okay, so the next muscle we're going to do is the trapezius muscle. So for the trapezius, again, this one is coming off the spinal accessory nerve, so you would really only do this one if you suspected a injury of the spinal accessory nerve, or if you had upper motor neuron, or lower motor neuron injury like ALS. You can check that muscle as well. The trapezius is we're going to check the upper trapezius, but you can do the middle or lower as well, but the upper trapezius is the easiest one. And this one is going to be elevation of the shoulder. So you can ask the person to do a shoulder shrug. So again, with this muscle, you're not going to go straight in through because the lung field is right behind that. So again, you're going to go at an angle, you're going to go lateral to it. You're going to go coming inside this way to get to that muscle there. So there's the trapezius muscle right there. and we're going to come in and go to the side. So we're going to insert the needle down that way. Okay? So I take the area of the skin. There we go, nice and good. There's trapezius muscle there. Take the needle, inserting it in downwards. Okay, nice and relaxed. Here we go. Feel okay? Okay. Shrug your shoulder up. Bring your shoulder up to your chest. Okay, we're not in yet, so relax it. Okay. So I'm going to move the needle a little bit. Okay, so it's not in there, so I'm just going to take the needle out. Doing okay? Bring your shoulder up, push up. There we go, let's try right there, relax it, relax, good. So we're going to come right in there. Okay, nice and relaxed, here we go. Okay, now push your shoulder up. Not there. Okay, relax. There's your trapezius. Doing okay? Okay, put this here. Come right in there. You can feel it's right there, but it's not hitting the muscle though. Let's try it one more time. Okay, nice, relaxed. Here we go. Push up. Not hitting it. Relax. That's the shoulder. Let's come over here. Doing okay? Okay, now push up. Okay, now we're in. Okay, relax. All right, so now we're in the trapezius. Okay. There we go. Okay, bring your shoulder up. Good. There's a trapezius muscle. So we're getting some nice motor units. Okay, relax. So now I can assess my quadrant technique. I'm a little bit short on muscle, so I can't go too many locations. There we go. So I'm trying to find different areas of the muscle. Again, not going too deep, not going too, you okay? There we go. Relax, relax. So I'm in muscle. All right, let's check for some motor units. Let's store that buffer. Store the buffer. We'll go to... Now we'll go to 200. So gently try to shrug your shoulder up. Good. I'm going to insert it just a little bit down. There we go. There's some nice muscle. Push up. There we go. There's some nice muscle tissue there. There's some nice motor units. Good. Doing okay? Good. There's some motor units there. Okay, push your shoulder up. Good. There's a couple more nice motor units. Good, and relax. Okay, so let's pretend that was 12. Stop it. Store the buffer. And this one's going to be hard for me to resist him. So we'll go back to live again. All right, push down, push your shoulder up. So we're getting some good motor units. Go a little stronger. And relax, good, rest. Feel okay? Mm-hmm. All right, so that was for trapezius. So again, not one that's very commonly done. Store that buffer, good. Put a little pressure over here. And then lastly, we're going to do one of the rhomboids. So turn this way to the side a little bit. And now we're gonna, for the rhomboid is really, mainly a C5 muscle. So we're gonna do the lift-off test. So for the C5 muscle, this is an indication to do the rhomboids. Because it has no C6 contributions. So the rhomboid has C5 without having C6. So that will be the indication to do the rhomboid muscle. So I'm selecting rhomboid on the screen. And the lift-off test, so now we're going to ask the patient to bring their arm back behind their back. And we're going to have them lift their arm off their back. So we're going to have them lift their arm off their back. And as they do that, while they're doing that, you feel the inferior border of the medial border of the scapula, and the rhomboids are coming in up underneath it. So again, you're going to angle towards the border of the scapula. So you're going to insert the needle in this way towards the border of the scapula, and your muscle will be right in there. So that's where the rhomboids are going to be located. Okay, so then you can relax for a second. Good. Okay, so there's the, my thumb is at the scapular inferior angle. So I'm going to take the needle, and again, I'm inserting it this way, towards the medial border of scapula. So I'm inserting it that way. Okay, nice and relaxed. Here we go. Okay. Bring your hand off your chest, off the back. Good, we're getting close. Relax, relax, relax. So I'm going to insert it a little deeper. Okay, push back. Okay, this needle may not be long enough. Relax it, relax, good. Insert just a touch deeper. There we go. Now I'm in the muscle. Because he's moving his arm off, push up against me, and those muscles, motor units pop up nice and big. So this needle may not have been long enough. He's got a well-developed shoulder, so you needed to get a little bit deeper into that one. So okay, relax. So now I can check my quadrants. Where's one? Relax, relax. Two. Extract out. Doing okay? There we go. Nice and quiet at rest. So I can check 3 quadrants, 4 depths, store that buffer. That's under rhomboid. Store that. Go back to live again. Now I'm going to resist him bringing his arm off his back, so push up. And not that quite good, so relax there. I guess just going to change the angle a little bit. Okay, push back. Good, now relax, relax, good. Hang it in there. Almost done. There we go, now we're in. Okay, now push up. There we go. There's some nice crisp motor units. Again, trying to find what you can on this one. There we go. There's some nice normal motor units. And relax, relax, good. So I store that buffer, store it, and now we'll do the best we can to get the maximum. Okay, push up. And a little more. A little more. And relax, good. So again, this one's not too easy to get good recruitment of. Take the needle out. Got a little blood there, so we'll put a little swab. And now we'll store that buffer. Stop it and store it. Good. Feel okay?
Yeah.
All right, so those were the trapezius, flexor carpi ulnaris, and rhomboid muscle. Thank you.